Hello all. Today we are presenting our project COVID Care Robot, which is designed to reduce contact risk between health workers and patients. The system is based on robot operating system and is having a dedicated user interface. The robot is basically a differentially driven mobile robot which have both autonomous navigation and joystick control functionality. The robot is having a weight carrying capacity of 40 kg and have dynamic obstacle avoidance capability and also will provide sound instructions to patients. These are the 5 applications suggested for the prototype.
I will start with food and medicine delivery using autonomous navigation. A room number is given as a goal point and the robot plans path to the room. When it reaches the room, it delivers an instruction to the patient to take food.
Hi sir, please take your food and medicines.
Next is the hardware demonstration of the same food and medicine delivery using autonomous navigation. The robot will plan path to the goal and then delivers a sound instruction so that the patient can take food.
Good morning sir, please take your food and medicines.
Sound instruction is done using raw sound node. The program is done in such a way that when it reaches the goal point, it will deliver a sound instruction.
Next is the simulation video of room sanitation mode. You can see the robot inside the room. The room should be closed before using this mode, so that the mobile robot is moving randomly without colliding the obstacles throughout the room, and after some time almost all area of the room will be covered. Next is the hardware implementation of the room sanitation mode. A sanitation spray will be fixed on top of the mobile robot, and the spray is triggered mechanically. Then you can see that the spray is spraying the sanitation liquid to the entire room by covering the path inside the room. It is a collision-free random movement. So within some time it will cover almost all areas of the room. It will sanitize almost all areas of the room. Next is the non-contact hand sanitation. The robot will plan path to the room. If the patient wants to sanitize his hands, he can show his hands under the tube for getting the sanitation liquid. The air proximity sensor detects the hand, and the DC pump will pump the sanitation liquid. The nozzle attached at the end will reduce the flow. Next is the daily inspection and attendance marking of patients.
Hello Sazi.
Okay, this is done using a deep learning network. The network is trained using the images of the models in this gazebo world. Also, I have trained using images of my family members. Okay, so I have given some name to each models in this gazebo world. I have named this model as Shankar. The robot will tries to detect his face.
Hello Shankar.
See the terminal at the bottom. The name Shankar is added to the attendance register. This is the hardware implementation of daily attendance. If the patient is wearing a mask, the deep learning classifier will tell the patient to remove the mask. It will detect the mask and tell the patient to remove the mask for a minute for daily attendance registry. When patient removes mask, the mobile robot will recognize the face of the robot, greet her by using her name,
Hello, Sanjuna.
and log her name to the attendance. Last feature is a remote doctor consultation facility equipped with a robot. This is a chat app I have created using WebRTC concept and some available libraries. This is a video conferencing app so that the doctor will be able to consult the patient. In a tripod, the phone or tablet will be attached to the mobile robot.
Next, I will be explaining the fabrication stages of the real robot that we have implemented in Medical College Hospital, Trivandrum. Here, the main frame of the robot is made using GA square pipes. And we choose a design that fulfills the purpose of the robot, which is to have a payload of above 40 kg. The controllers used were Raspberry Pi, but the main processing happens and the motor control was done using Arduino Mega. Our robot is working in ROS platform with a combination of sensors to navigate to the desired location. And also, we took care that the robot had a design which was aesthetically pleasing as it is to be deployed in a public space. We had a few trial and errors on paper during the design phase, and once we finalized on an optimum design, we started the fabrication process. The motor selection was based on the requirements that the robot should be able to carry food packets and essentials to the whole ward inside the hospital. The user will be provided with a user interface where we will be able to give the bed locations so that the robot will navigate to the bed locations. On deploying robot to a new location, we have to map the entire region. Once it is done, the robot will be able to navigate to desired locations inside the map, or else we can control using joystick. During the final stage, our aim is to humanize the robot so that along with fulfilling its purpose, the users and the people interacting with the robot will have a pleasant experience. We tested the robot on varying terrains and different scenarios where we made sure that the end-to-end working of the robot was functioning smoothly. This included the connectivity, navigation through obstacles, integration with the user interface, and safety parameters. The robot has features like non-contact delivery of food and essentials to multiple beds in one running. This is possible due to its payload capacity of about 40 kg. Also, there is a telemedicine facility where the robot can interact with the patients and keep tabs on how they are doing. So, basically, there are 3 applications for the real robot that we have implemented in Medical College Hospital, Trivandrum: transport of materials, food and medicine, non-contact sanitation, and telemedicine functionality. So, this is the story of our robot. The first thing in every project or venture is the idea. Once the idea is clearly understood, then begins the journey towards its fulfillment, which is a gradual process with many trials and errors. Thank you.